So, my name is Daniel Stillwell. I am the editor of the IFTA e-newsletter, and we are here in Spain with some people who have a presentation that they'd like to tell us a little bit about. So we've got Nausheen Qureshi, Zahra Somani, and Adam Jones from Texas Women's University, right?
Yes.
Okay, wonderful. So just briefly, because we have people from all over the world, what kind of clinician or therapist do you identify as? What does that look like where you're working? And anyone can start.
Sure. So I think that being in Texas is part of the what informs the context that informs the type of clinician that I know I want to be. There is a large South Asian and Muslim population in Texas, and now we're finding more and more that South Asians and Muslims are both willing to access therapy. And at first it was a trickle, and now there's more and more of the population, but we're not so sure that there's enough clinicians that are prepared to work with this group. So I think that more and more the way that I see my future shaping up is sort of filling that niche and kind of working through not just servicing those clients in that population, but also preparing other clinicians to do the same.
Yeah, so kind of like Zahra, I would say I'm working from a similar context within the Muslim community, but I'm also a first-generation immigrant, and I think that very much informs the way I hope to practice and be able to meet clients and their unique identities within the Muslim community as well.
Fantastic.
Mm-hmm.
I'm Adam Jones. So I teach in the Marriage and Family Therapy program at Texas Women's, and we have one of the most diverse institutions in the country. We really love the diversity there. We have a lot of students from different backgrounds, and it's a really rich learning environment. So clinically, I have a small private practice and just work as a marriage and family therapist.
Okay, wonderful. Well, then tell me about your presentation. You're giving a talk, or you already gave a talk here, so tell people what it is that you're doing.
So the topic is looking at navigating conversations on gender and sex with Muslim clients. And we start by kind of looking at what are some of the particularities within the Muslim context around gender and sexuality. But ultimately, it's a much broader conversation about what does it mean to be a therapist with diverse clients. And I think you can speak a little bit to that.
Yeah, I think a lot of times when people may attend presentations about navigating certain topics within certain populations, there's a lot of focus on cultural competency or learning about how this specific topic applies to this specific population. Instead, we're kind of taking a different approach. It's more focused on the therapist and their orientation toward clients and getting them to think a bit more from a paradigm of their therapeutic orientation toward diversity and different cultures and identifying intersectional identities that their clients come in with, and how specifically we'll give a bit more of some information about Muslim clients and how that intersects with gender and sex and some of those topics that may come up. So It's more of a shift on the thinking of the therapist rather than the sensitivity or the competency of the therapist.
Right, and the term cultural humility is one that I know that some people are familiar with. So that sounds like what you're getting at. And at this years in the U.S., looking at the intersection of gender and sex and religion is quite powerful, as different states are engaging this in different ways. Not all are a good one. What else would be good to know about what y'all are working on?
Yeah, I think what Dr. Jones was talking about, especially with the intersection of different identities, I think it's very important for us to be addressing that as clinicians. We can see we can sometimes with our biases see our clients coming in with like a primary identity, and so I think unless that is being brought up as the primary concern, we kind of want to just like keep that there while also recognizing all the different identities that are impacting or coexisting with that identity that we're seeing. So especially I know we'll be addressing certain theological institutions within Islam in our presentation, but at the same time we want everyone to kind of step away from that and be like, okay, they're more than just Muslim,
Right,
right? So
right.
this is the different ways of being a Muslim is what we're really hoping to emphasize in the presentation.
Okay. So some of this sounds like it is education for the clinicians to be aware of what is what and who is who. Are there particular takeaways that you want to have for that intersection?
Yeah, actually, I think one of the biggest takeaways that we are hoping our, people who come to this presentation walk away with is this idea that Muslim is one part of an individual's identity. Often what we see is that when there's a sort of bigger identity or something that we're unfamiliar with, it ends up becoming the focus. But actually, what it means to be Muslim is impacted not just by theology and your culture, but also your gender, your immigration status, your sexuality. Like there's so many factors that make up even how you engage with your religion and express it, that as a therapist, you don't need to be an expert in this. You need to be able to see that person as a person. And so sometimes it's helpful to have this information in the background. But the biggest takeaway is that when a Muslim walks into your clinical space, is that even their primary identity? And what does that even mean, right? In terms of, I was telling somebody the other day that for 1.8 billion Muslims that practice, there's 1.8 billion different ways to practice Islam, right? So to not walk away with something that's standardized or cookie cutter takeaway, say, this is a Muslim client, but rather to kind of, as we do with everything therapeutic, nuance it, both and let everyone know that it looks 100 different ways.
Right. Even some of the theological principles that you mentioned, not everyone prioritizes them in their own life in the same way.
Exactly.
So, okay. Any other thoughts or concepts on your presentation or other work that you might be engaged in that would be interesting to share?
I'm also engaging in some work with some of the other faculty and classmates at Texas Women's University about multiracial families and how to work with those in the U.S.
Yeah.
And I just think it's, again, very intersectional and important to kind of see that is becoming more of that's a changing landscape in the United States, where multiracial families are becoming more and more common. So we're bringing those aspects of our religion, of our culture with us. And so it's just fun to kind of see both areas of my life and research kind of overlap.
Very nice. Yeah. Anything for you?
I think a lot of what I focus on in my research is more about clinical effectiveness. What skills can we teach therapists that can help them improve clinical engagement, get families working together, working toward meaningful outcomes, and so those are some of the things that I talk about a lot, and we're doing some work that really focuses on some of these concepts related to this multicultural orientation, which is kind of that paradigm shift that I talk about. But we have we've been able to measure some of those things, and I think it can be helpful for therapists to know that there's a good body of work out there, especially related to client outcomes, that gives us some insight as to how therapists can enhance their cultural humility, but also there's just developing a comfort talking about cultural topics. And there are also aspects related to taking cultural opportunities, right? Recognizing when are opportunities to integrate culture into therapy, and maybe, or if we missed opportunities, if there are ruptures that resulted in that. So there's kind of maybe a way of being that the therapists can present with, but hopefully that's something that we can train and teach clinicians how to do more effectively.
It sounds like you've got a lot of rich material to work with. Even as you're saying that, I'm thinking about international families and interreligious families, and how so much of that clinically is about providing space and not leading with judgment or putting people in their boxes or whatever. And so I think that, this is awesome. Thank you very much for being here. I'd like to end on a slightly fun question. You're from Texas. This is Spain. Let's highlight something in Europe. Where is a place in Europe you would like to go but you haven't been yet?
Iceland.
Okay.
Yes.
Any reason why?
I really want to see the Northern Lights.
Okay.
It is like a dream of mine since I was a kid. And I hear that the views there are spectacular. So
Very nice.
Yeah.
I haven't been to the UK yet.
Okay.
But I do have family there, and they're always sending me really great pictures. So I guess more to visit family, but also just to, I'm a big history junkie. So
Yes. Hi, Nausheen's family.
so I would like to
Yeah.
go see some historical points.
Oh, that'd be great.
Yeah.
I'd love to go to the Alps. I've got some travel planned
Okay.
coming up that will be nice. So we're just hoping to get up into the mountains and enjoy peace and quiet, which can be nice to get away from. So
Very cool.
so nice.
Well, thank you so much, Nausheen, Zahra, and Adam. Appreciate it. We'll see you around.
Okay.
Thank
thanks.
you.